I am Dr. Ilse Horo, a dermatologist from the Shefflin Institute of Health Research and Leprosy Center, Karigari, Vellore. Today I will talk about epidemiology of leprosy and its clinical presentations. Before I move into the epidemiology, I would like to talk about what is leprosy. Leprosy is a chronic disease, least infectious disease caused by a bacilli, the Mycobacterium leprae. It affects the peripheral nerves, the skin, and the mucous membranes of the upper respiratory tract and the eye. Leprosy has the ability to cause nerve damage and lead to disability. Leprosy comes with social stigma, ostracism, and denial of human rights. In 1873, a Norwegian physician, Amor Hansen, demonstrated the leprosy bacilli. Hence, the other name for leprosy is Hansen's disease. Now we move on to the epidemiological factors which deals with agent factors, host factors, and the environment. Now first we are going to talk about the agent, that is the M. leprae is the only species of mycobacteria to infect the peripheral nerves and especially the Schwann cells. The untreated leprosy affected person is the only known source of M. leprae. Leprosy is transmitted from an untreated leprosy affected person to a susceptible person via the respiratory tract. Major sites from which the bacilli escape from the body from an infectious person is through the respiratory tract and especially the nose. Only a small proportion of those suffering from leprosy can transmit the disease. Respiratory route appears to be the portal of entry for the leprosy bacilli. The incubation period varies from few weeks to as long as 20 years, average duration being 5 to 7 years. Now this slide talks about the host factors. Leprosy can occur at all ages, ranging from early infancy to very old age. The youngest age reported is as old as 3 weeks. Although leprosy can be found in both genders, males as well as females, but is predominantly seen more in males. The household contacts of leprosy are at greater risk of developing the disease. The occurrence of leprosy depends upon the susceptibility and immunological status of the individual. The environmental factors. Humidity favors the survival of the bacterium. Risk of transmission increases with humid conditions. The risk is increased by closeness and duration of contact. But all these factors will be operative only if the person is susceptible to the disease. Leprosy is a disease which is usually associated with poverty and related factors like overcrowding. However, it affects persons of any socioeconomic groups. Now we move on to the diagnosis of leprosy. A case of leprosy is diagnosed by eliciting cardinal signs through clinical examination and bacteriological examination. We can encounter leprosy patients coming to us under the following headings. We can get them as new cases of leprosy. We can get patients who are under treatment. We can get patients who are partially treated. We can get a case of relapse. We can get a case of reinfection. We can get old cured cases. And we can get old cured cases but with severe disability. This slide talks about the cardinal signs of leprosy. There are 3 important cardinal signs of leprosy which help us to diagnose the disease. The first is the hyperpigmented or erythematous patches with definite loss of sensation. Second is the involvement of the peripheral nerves, which is demonstrated by thickening of the nerve, loss of sensation, or weakness or paralysis of the muscles which is supplied by that particular nerve. And third is the skin smear positivity for acid-fast bacilli. If any one of these are present, it is sufficient to make a diagnosis of leprosy. This slide has 2 pictures. One picture showing the paucibacillary leprosy, which has a single patch, and the other picture has multiple patches, which is a multibacillary type of leprosy. This slide talks about the classification of the disease, and the leprosy is classified into multibacillary and paucibacillary according to the WHO. MB stands for multibacillary and PB stands for paucibacillary. There are 3 characteristic things that we need to see while classifying the disease. They are the number of skin lesions, the number of nerves that are involved, and the skin smears. In the paucibacillary case, the number of skin lesions vary from 1 to 5. There is no nerve or only single nerve involvement in the paucibacillary cases. And the skin smears are negative for the bacilli at all sites. Whereas in the multibacillary cases, the number of skin lesions are more than 6, the number of nerve involvement is more than 1, and the skin smear is positive for the bacilli at any site. Now this slide talks about the treatment of multibacillary and paucibacillary. The treatment is divided according to the adult regime and the child regime. And this slide talks about the adult regime. In the multibacillary cases, we have 3 drugs which are given. They are rifampicin, clofazimine and dapsone. Rifampicin is given in a 600 mg monthly dose and clofazimine 300 mg monthly dose. Dapsone 100 mg is given daily and clofazimine 50 mg is given daily. Whereas in paucibacillary cases, there are only 2 drugs which are used for the treatment. They are rifampicin and dapsone. 600 mg of rifampicin is given once a month and 100 mg of dapsone daily. The criteria for release for treatment in the multibacillary is completing the 12 monthly scheduled doses, whereas in the paucibacillary cases, it's completion of 6 monthly scheduled doses. This slide shows the child regime for multibacillary and paucibacillary leprosy. In multibacillary leprosy, there are 3 drugs given: rifampicin, clofazimine and dapsone. Rifampicin is given in a dose of 450 mg once in a month. Clofazimine is given 150 mg stat or once a month, followed by clofazimine 50 mg once daily. Dapsone is given in a dose of 50 mg once daily. The paucibacillary type of leprosy has only 2 types of drugs, rifampicin and dapsone. Rifampicin is given in a dose of 450 mg once a month, and dapsone is given as 50 mg once daily. The duration of treatment for multibacillary leprosy is 1 year, that is 12 months, and the duration of treatment for paucibacillary leprosy is 6 months. This slide talks about the disease prevention. There's primary prevention, secondary prevention and tertiary prevention. Primary prevention is done by vaccination, chemoprophylaxis or health promotion, whereas secondary promotion is early diagnosis and prompt treatment of the disease. Tertiary prevention is done by rehabilitation and disability limitation. Thank you.